Hello everyone, this is Erin Sparnan. I'm an engineering manager here at ECRI Institute and I will be your moderator today. It's my pleasure to welcome you to this webinar being held by ECRI Institute's Health Devices program. It's our third of the year. We have over 150 attendees on the line today and we appreciate everyone's time and attention. Today's program is called Medical Device Cyber Alerts. Plan, don't panic. Today, more than ever, healthcare organizations need effective cybersecurity risk management practices to ensure continuity of care delivery while efficiently utilizing staff and financial resources. While cybersecurity risks can never be fully eliminated, risk management activities can help reduce the overall risk to acceptable levels. In an increasingly connected world, the pressure is on to quickly triage and assess the risk profile for incoming medical device cyber alerts, yet many healthcare organizations are wondering where to start. Today, ECRI Institute's cybersecurity experts will cover what they're seeing in the medical device cyber alert world, and also describe how to establish risk profiles for incoming alerts. Let's meet our faculty. Both Juuso Leininen and Chad Waters are senior project engineers in the Health Devices group here at ECRI Institute, and we'll give them a quick introduction as we get to their section in today's webinar. Before we move on to our presentations, here's some administrative details. You can find all webinar materials at the website listed on this slide. And tomorrow, you should receive an email through GoToWebinar from Barb Malanga with a link to where you can download the slides for today's program, and later, the recording. Let's begin today's webinar with Juuso Leininen's discussion of security alerts. Juuso Leininen is a senior project engineer at ECRI Institute. He led ECRI's development of a standard assessment for all of ECRI's networked connected medical device evaluations, published several guidance articles to aid healthcare facilities in practical management of medical device security, ranging from appropriate medical device security inventories to security assessments during procurement, and has been the lead subject matter expert on assessments of medical device security management plans and inventory-based risk remediation assessments. Juuso, take it away.
So in this first section, I'll be focusing on coverage from ECRI security alerts. ECRI has seen a significant interest in security alerts for medical device vendors over the past few years. And during these first few slides of the presentation, we'll take a look into the kinds of insights that we have received from analyzing those specific alerts. As many of you are probably aware, ECRI rated cybersecurity and ransomware threats as the #1 top 10 health technology hazard for 2018. This is primarily due to the reason that last year we started to get reports of cybersecurity-related disruptions to healthcare operations and causing even closure of certain healthcare units, leading to delays in patient care, which can absolutely cause patient harm. With this article, we wanted to highlight two key things. Firstly, that cybersecurity is and should be thought of as a patient safety concern that can impact care delivery overall. Secondly, we also wanted to outline that cybersecurity is absolutely not just an IT issue, but especially in healthcare institutions, is something that touches every single group or every single department within your organization, all the way from your C-suite down to your front-end clinicians. There's definitely something that each one of the groups can do to lead to a more secure environment. And that is exactly the approach that we took in the top 10 article. We provided high-level recommendations ranging from all of these groups to get everybody started. Also, a reminder, the ECRI's top 10 health technology hazard list for 2019 is just about to be published. The public release is going to be next Monday, so definitely stay tuned. But as a sneak peek, we wanted to share today that cybersecurity is absolutely still on the list. Make sure to go and check it out, the specific angle that we were focusing on this year, as well as how far toward the top it made. So again, something to look for early next week. But overall, over the course of the past 3 or 4 years, in general, we've seen a significant interest from our member base about medical device cybersecurity. This is manifested in various different forms. Firstly, an increased member interest in cybersecurity. from how do I incorporate medical device cybersecurity assessment as part of my procurement practices, to how do I respond to an ongoing security alert. We also heard reports from our member hospitals specific to cybersecurity, which we've investigated on our members' behalf. And finally, we've also seen a wave of vendor notifications about cybersecurity. Really, over the past 2 years, there's definitely a lot of vendors who've become more transparent about security of their products. Vendors are sending out field correction notices and field correction notices about vulnerabilities that exist within their product, as well as providing mitigations on how to address that. Overall, this interest in covering cybersecurity from various aspects has led to some of the following key efforts within the health devices group. We've now effectively incorporated security assessment in all of health devices, medical device evaluations. This is done via a standardized questionnaire form that ECRI has developed with the help from medical device manufacturers as well as healthcare facilities, essentially with the goal of trying to get easy to compare information about security capabilities of medical devices. And that's really, rather than focusing on characterizing each medical device and how many thousands of vulnerabilities may exist in it, we thought the much more productive path is to identify what kind of an impact a device is going to have and what are the requirements of it when it is incorporated in your hospital's network. And that is now a standard requirement for all of our network-connected medical devices. We cover about 30 to 40 different evaluation categories annually that now incorporate this set of information. We've also moved forward with a number of different guidance articles focusing on cybersecurity of medical devices. And we thought it was especially important to cover how certain IT common best practices, what do you need to keep in mind when you're trying to implement that, those mitigations around your medical devices. And that's with the Cybersecurity Essentials website. We cover a number of these different articles ranging from tips on vulnerability scanning of your medical devices to tips on analyzing your MDS squared forms. And finally, we've expanded ECRI Institute's coverage of security alerts through our alerts tracker recall management software. So since 2016, we've seen a fourfold increase in security alerts overall. Again, largely driven by the fact that medical device vendors are submitting more and more security notifications that are publicly available. And we've established methodologies on how to move forward and address these cyber alerts. So our current process that is in place evaluates a range of different sources for security notification, including ICS CERT, vendor security bulletins. We're referring to the public websites that are now available from a number of different medical device vendors, as well as you, our member hospitals, who are submitting cybersecurity-related field correction notices to us, as well as security researchers in some instances. With all of these incoming security notifications, our medical device security team determines how complete is the information. Is there additional clarification and guidance needed for hospitals to take action? This review includes identification of if practical steps and actual mitigations exist within the initial vendor communications. If sufficient, we are moving forward very rapidly to publish and make sure that those alerts get to ECRI's members as fast as possible. However, during this initial triage stage, we're able to identify promptly if a notification is simply inadequate for a hospital to actually take action. And that's where we can leverage ECRI's internal resources as well as our product security contacts at medical device vendors to clarify and identify additional recommendations that could be acted upon. Finally, these are all still distributed through ECRI centralized ECRI alerts tracker software. And I will take a look at a few examples of the items where we thought additional ECRI commentary would be valuable. So first example is Ethicon-Gen11 related cybersecurity notice. So if you're not familiar, Gen11 is a generator used in the operating rooms with relevant handpieces, and this is something that Ethicon came out last November with a cybersecurity notice that required healthcare facilities to move forward with a software update. So this was described in this initial communication as just a routine cybersecurity update to mitigate an authentication vulnerability. However, the update itself actually impacted the ability to use some third-party reprocessed consumables, and that caused a lot of concern for ECRI's members, and frankly, a lot of confusion. So after this came out, we started receiving a lot of calls, and are all of the reprocessed consumables impacted? So we decided that it was best to clarify. So we worked with Ethicon and provided the following commentary focused on the Ethicon-Gen11 systems shortly after the initial publication of the alert. We wanted to clearly identify that this is a single handpiece, the Harmonic ACE+7 ultrasonic device that is impacted by this particular update, and provided additional recommendations. Before updating any of these Gen11 systems, you need to be absolutely aware of the implications of it. Again, if you're a facility that used reprocessed Harmonic ACE+ ultrasonic devices, those would no longer be suitable for use after the update that has been conducted. And we also caution hospitals who had already moved forward with the update by the time our alert came out to remove any of the Harmonic ACE+7 ultrasonic devices from use. This highlighted a specific security alert that prompted a lot of ECRI's members to act and update their devices, because there was a cybersecurity notice out, and there was even a fix to it, which is definitely not the case all the time. But the important aspect arose very quickly when folks started realizing that there is some impact to healthcare facilities' ability to utilize the device how they were using it previously. But again, highlighting how important it is through all of these processes to make sure that any sort of software updates, whether they're cybersecurity or otherwise, you appropriately assess the risk as well as what the impact to your clinical workflow is. Especially with these devices, one of the key concerns was that the Ethicon-Gen11 was actually not a wireless or network-connected medical device, nor did it contain any PHI. The second example was related to, in general, PACS servers directly accessible from internet that may pose cybersecurity risks. This was derived from research conducted by McAfee, who identified a number of different PACS servers that were identified as potentially exposed. Subsequent to the initial McAfee notification, we saw notifications from both GE as well as Philips focusing on the PACS servers, their own PACS servers, which were also covered through ECRI's alerts. So again, this was a high-level alert in general, focusing on PACS servers and outlining what some of the consequences might be if a PACS server is suddenly not available. Some of these include unauthorized access to PHI, potential to alter studies, and most importantly, really the denial of service. If you suddenly don't have access to your PACS server, this has the potential to delay care. We recommended hospitals to move forward to prevent this from occurring, regardless of which vendor PACS system you were looking at, by following vendor recommendations and updates. the best you can, while recognizing that this is not always practical. However, if merited, you should definitely move forward and update systems and follow the vendor security practices as outlined. A couple other things to keep in mind is, especially if external access is required, utilize VPNs, as well as use best practices for network design, network and firewall design, and implement two-factor authentication as well. Always, if there is an incident or suspected incident, absolutely initiate your incident response plan, and also make sure to include the instances of if it is a related specific to a medical device. And part of that is also going to be considering whether you should disconnect the device for the duration of the remediation. That is always an option. However, you need to always identify the related clinical workflow impacts that may exist if you suddenly disconnect a device from the network. So finding the best way is highly dependent on your individual organization and how that particular device is used. On our third example, we covered a notification from Abbott in terms of their iStat, a blood analyzer, it's a handheld analyzer, which Abbott notified their customers in May 2018 that that device contained the widely publicized KRACK vulnerability. So this was, if you're not familiar with KRACK vulnerability, that is, it was prominently highlighted earlier this year, impacting a number of different medical devices. Medical devices, and iStat was also impacted. Abbott's recommendations in this particular case, we didn't feel like they completely remediated the concern, and we wanted to highlight this in a publication. So we, shortly after the initial publication from Abbott, moved forward with additional recommendations. The initial notification essentially focused on outlined that if there's a concern with the VPA2 encryption, that hospitals should utilize other ways of encrypting, but that effectively means in this case using web encryption. And overall, the vulnerability had the potential to cause loss of confidentiality of EPHI. We worked with Abbott in terms of our recommendations to move forward with, to apply patches whenever Abbott released them to fix the KRACK vulnerability. Ensure also that any KRACK vulnerability patches are mitigated in your overall wireless infrastructure, which doesn't void the problem, but it definitely takes care of the other half of the coin. Abbott did, shortly after ECRI's notification, update their initial communication, providing a timeline for their software update, as well as providing a clear indication that they do not recommend hospitals to utilize web or open authentication, and finally provided alternative method to manually utilize the network connected device without manually use the network connected device. So those are just some of the examples of where ECRI has moved forward based on an initial security communication from a vendor, investigated it, and provided additional practical recommendations on how to move forward with. Overall, we recommend you to definitely, with the light of these new security alerts, to have a responsible person within your organization who focuses on them, whether it's biomedical engineering or IT. We recommend you to periodically review the security alerts, as well as if you're getting confusing security alerts, especially from your members, from your medical device manufacturers, do report them to ECRI. We can, again, assign resources on our behalf to investigate the matter, reach out to our product security contacts, and see if additional clarification is merited. For those facilities who are not members of the alerts tracker and don't get the centralized source of these vetted alerts, Here's a list of some of the public-facing supplier security notification websites that we're currently monitoring, which can hopefully be helpful as you tackle this increase in security alerts. So back to you, Erin.
Thank you, Yuso. I really appreciate your perspectives. We will now proceed with a session on risk assessment from Chad Waters. Chad is a senior cybersecurity engineer in the Health Devices Group here at ECRI Institute, where he performs medical device evaluations, develops practical guidance for healthcare facilities, and consults with healthcare facilities about medical technologies. He's a subject matter expert in medical device cybersecurity and healthcare IT, arriving at ECRI Institute with 13 years of experience in IT security and network engineering within the healthcare field. His most recent healthcare position involved coordinating IT and networking aspects of his facility's acquisition by a larger healthcare system. He holds a BS degree in Information Technology from Rochester Institute of Technology. Chad, go ahead.
All right, thank you, Erin. So Yuso set us up with explaining how alerts come in, and I will be talking about how to handle them. What do you do when a security alert comes in? You need to assess the risk to plan and prioritize remediation. There's a couple of steps you need to do. Inventory the assets. What do I have? What could be affected by this advisory? Then you need to identify the vulnerabilities. Those are usually spelled out within the alerts, and you can, from there, develop the list of threats that could potentially happen from that. And then you need to assess the risk. Really, can this really happen? How bad can it be? Inventorying the assets. This would be searching for affected models and systems. Your IT department may have an inventory, and your clinical engineering may have another. You need to work together to develop a cohesive inventory to be more comprehensive. In the case of a non-device specific alert, such as a vulnerability to an operating system, you may need to reach out to the device manufacturers to find out if that particular device is affected by this. And there's movement towards software transparency. Basically, if you have a device, it'd be good to know the parts under the hood, and there are initiatives to be more transparent about this, including an upcoming revision of the MDS² form that would ask if there actually is a software bill of materials, or SBOM. This is some recommended information you should be collecting with your inventory initiatives. You should be collecting these when new devices come in and at preventive maintenance. We'll go over a couple of these. There's some software information. There's some networking information, and there's details about what kind of data is involved. Does it have PHI? Does it have passwords to some other sensitive system? You need to know who the system owner is. That's important for scheduling updates. And the product life cycle is important as well. If this device is unsupported, maybe I should consider finding a replacement. So once you have an inventory, you need to identify the vulnerabilities and the threats. Now there's a key difference between vulnerabilities and threats. Vulnerabilities are the weaknesses within the device, and the threats are what can exploit those and do something adverse to the device using this weakness. Vulnerabilities are the how, and ICS CERT, which is one of the main sources for our advisories, they're mostly focused on vulnerabilities. They may hint at threats, but our ECRI alert tracker, as needed, we will clarify and pick out some that may be worthy of notice. So one of the things you can see in a security alert from ICS CERT is that there are technical details about the vulnerability. We call the Common Vulnerability Scoring System, version 3.0. The base score is from 0 to 10, 10 being the highest, 0 being the lowest. Won't go into how everything is calculated, but these are the parameters that they use to determine it. And if you were to look at the data, they could provide some insight on what actually the vulnerability is doing. Attack vector, whether or not you need physical access, or you can do this remotely from the network, or if you have to have if you have to be locally authenticated. Attack complexity, how easy is this to handle? Can script kiddie do this, or is this a very sophisticated attack? Privileges required, do you have to be authenticated, or do you need root access? User authentication, can a worm affect this, or does this have to be a human attacking the system? And scope, whether or not the vulnerability is contained, or whether you can elevate your privileges and move on to the overall system. And then we have the CIA triad of security. This would be your confidentiality, whether or not maybe PHI is at risk. Integrity is whether or not you can change the data of a system. And availability is whether you can hinder access to the data of the system. And these go into a lot more detail at CVSS website. Here's an example vector string, which would spell out those attributes. This particular one is pretty bad. We got attack vector of network. I can tell that it's an easy attack to pull off. You don't need any privileges, and no user interaction is needed, and you can pretty much do anything to the system with the CIA triad. This is the vector string for EternalBlue. Obviously, I could tell you that would be pretty ripe for worm activity, and of course, this is the vulnerability that resulted in the WannaCry and Petya ransomwares of 2017. So those were the base scores, and if you wanted to go further into it, there are ways to modify it. In particular, the environmental scores are ways that an organization can tailor the severity to their systems. Maybe you already have compensating controls that protect the system in question, so maybe the network attack vector isn't really a factor, so you can modify that. And there's a calculator available for that as well, which is on this slide. So now that you have an idea of the vulnerabilities, it can determine what can happen as a result. The NIST guidance SP 830 describes a lot of these in detail, but this slide highlights a few that are relevant to healthcare, including viruses and malware, ransomware, of course. Cryptojacking is getting more prevalent. Instead of taking somebody's data for ransom and procuring money that way, you can just use the computing resources of somebody else's systems to mine cryptocurrency. Of course, hackers, inside threats, your potentially disgruntled employees or somebody that's got access to PHI that they shouldn't have, and they want to make a little bit more money on the side. There's misuse of resources, surfing the web from something that you shouldn't be surfing, maybe an X-ray control PC, and physical threat. You have PHI that's unencrypted on that device. Some vendors kind of downplay that, but if the device is something that can walk easily and be stolen, then that is a major concern for confidentiality breaches. So once you determine the threats, you need to determine the likelihood of an event happening, a threat happening. Sources that can help you determine the likelihood include the vulnerability severity, which we discussed. How easy is this to actually pull off? There's threat intelligence. What's the current threat landscape in healthcare? There's ransomware. There's cryptojacking. You should be keeping up with security publications, and so this scale here is provided by NIST again, and the URL for the paper is there. Pretty simple scale, it's kind of subjective. Go from highly unlikely up to almost certain, and the latter part of that, based off of how many times a year something can happen, that's more for non-adversarial threats, like maybe a disk error or failure or natural disasters. So once you determine the likelihood, then you also have to determine the consequences of an incident. And we'll start from the bottom of this. Goes from very low, which is negligible impact, up to low, which would be minor effects. And we're focused here at ECRI on patient safety. So in regards to physical harm to patients, this would be minor harm. Then we'd go up to moderate impact, which would be significant effects, or in patient safety scenario would be non-life-threatening harm. And then you go up to high, which would be severe degradation. This could be loss of core function. This could be ransomware taking down the data center, or like a death or a threat to life. And very high would be multiple high impacts. Of course, in healthcare, our top concerns are, of course, patient safety, including delay of care, PHI, and sensitive information breaches, financial risks, and risks to reputation. So this is an ECRI developed table to assign criticality to medical devices. How do we how do we apply that impact scale specifically to an X-ray machine, for example. And we recommend these 4 factors. What's the environment of use? What care unit is the device in? And then device criticality. What is this device used for? Is it life-sustaining? Is it therapeutic? Is it diagnostic? Or is it elective? And then also available alternatives. If this device goes down, do you have a plan B? Is that plan B sufficient? And then, of course, the one that gets in the news most often is the amount of PHI on a device, confidentiality, and the 500 plus threshold is is where you have to start reporting breaches. So that's a very low bar there at moderate. So once you have the likelihood and the impact, you can refer to this NIST provided matrix to determine the risk level. Of course, so if you have something that's got a high likelihood and a moderate impact, it's saying that it's moderate risk and so forth. So from there, you can prioritize your action and plan remediation. This would involve like scheduling. Do you need to do this now, or can it wait a month, or can you do it within your PM cycles? Is the risk low enough that the remediation costs are more than the actual risks, and maybe you can accept the risk? Or maybe you need to do this right now.
So yeah, hey everybody, just to summarize both of me and Chad's kind of a couple key thoughts that we want everybody to leave this webinar with. Again, sorry for the little bit of a late start, but it looks like we made it quite on time through most of the content. So a couple key things we want you to take away. Again, medical device security alerts are on the rise. We're seeing this on our alerts tracker. We're covering significantly more security alerts today than we were a few years ago, and this is definitely going to be a burden that is likely to increase on how to effectively respond to those. We now provide this kind of a centralized source for medical device security alerts through the alerts tracker, where we employ both assessment of those security alerts, provide you with additional content and guidance and recommendations when merited. ECRI has also published some tools that can help you in responding to these security alerts, as Chad outlined, some of the matrices that can help you assess the risk. This is, again, as a guidance article available also through the Cybersecurity Essentials. We want to take a look at that. And finally, it is paramount to have a champion or owner who is going to manage this increase in alerts and the related processes for your organization. So the past hour or so has been helpful for you, and I think me and Chad are now ready for one or two questions, considering, again, we're running a pretty close on time. But thanks, everybody, for listening in.
Thanks very much, Yuso and Chad. It's now time to start our question and answer session. So please use the question and answer section of your GoToWebinar panel to start typing in questions. We'll look forward to answering them for you. So I'm going to scroll down a little bit, and first question comes in, just asking about information on the presentations. So luckily we're on just exactly the right slide for that. Go ahead and copy down the ECRI's webinar homepage. Our recording and our slides will be there shortly. First question came in, how should we take cybersecurity into account when purchasing a new medical device? What requirements should be met?
So I can start off with that, you so We have recommended our member hospitals define a standardized methodology to apply across their RFI and RFP processes. There's a number of different resources out there, including a lot of resources in the ECRI Cybersecurity website that outline some key things to look for. Again, it is depending on your organization, there's going to be certain items that are a absolute requirement. We know some of our member hospitals who have identified, for example, the support for VPA2 enterprise level encryption is a must-have, and sadly there's still equipment out there who don't support it, but that specific flavor of encryption, it's a no-go for some of our healthcare facilities. So identifying your minimum requirements is going to be a key. And again, some of those resources out in the Cybersecurity Essentials are going to help you at least guide toward those. But again, we would recommend you to bring together different stakeholders within your organization, including IT as well as clinical engineering, to determine what those minimum requirements for your facility might be. Anything to add, Chad?
Looks like Chad's good with that answer. Next question came in asking, how does ECRI view the continued use of clinical imaging equipment that has Windows XP OS but still has significant useful life left?
So yeah, this is Chad. If you need to still use these particular devices, I would definitely recommend that you would use compensating controls to isolate it from the network and make sure that the only thing that they can talk to would be the maybe the PAC systems that to get the images, and make sure that like there's no other access to them. If you still need to use them, it's fine. Just keep them very, very isolated.
And this is Yuso, just to add a key point on that. One of the things that highlights is just the knowledge of what are the operating systems in your medical devices. And from ECRI's member base, we are seeing more and more hospitals who are focusing on gathering these kind of data points of all of their medical devices. So definitely, whether it's imaging equipment or any other equipment, you should definitely have those software versions and operating systems in your CMMS to enable you to go forth and apply some of the security mitigations that Chad just mentioned effectively across your entire fleet.
All right, we've got time for one more question. We had an interesting one came in. It sounds like it might be a common one for our member hospitals. It says, some medical device vendors will tell us that their product is standalone and doesn't need to reside on your organization's network. However, once the product is procured, delivered, and installed, we've found out otherwise. Is there any way we can be more proactive with medical device product vendors if we're not very technical?
This is Yuso. So I would refer to kind of the earlier point on making sure that you have a standard set of requirements or things you find out about each one of your medical devices that you're considering for purchase. And again, ECRI has developed a questionnaire that can help healthcare facilities do that in terms of characterizing what are the connections needed, what are the connections available on that particular device to facilitate to facilitate apples-to-apples comparison in terms of capabilities as well as requirements. And we're definitely seeing more and more devices connecting to hospital networks, more and more devices connecting remotely to other locations or the vendors to achieve a range of different benefits, from workflow to troubleshooting advantage. So it is definitely something that is starting to appear in various different device modalities, and again, guiding toward the standard method of identifying what are the connectivities, what is connectivity required, what is it used for, is it requirement or is it optional, things of that nature to definitely highlight in your initial procurement processes.
And this is Chad. I would like to add to that while you're in the procurement process, definitely ask for technical documentations like the MDS squared form that would have information regarding network capabilities, and definitely get your IT department involved in the evaluation as well.
Thank you very much, Yuso and Chad. So just a quick reminder that we will be continuing the Health Devices webinar series with one more session this year, and we will soon be posting detailed information about that program on our website. As a reminder, our webinars are provided at no extra cost for members of our Health Devices and Select programs, and you can find recordings and materials for today's webinar on the link on this slide, and also all previous webinars on the member websites for the Health Devices and Select programs. And so I'd like to give a big thank you to our audience today for your participation, and also a big thank you to Juuso Leinonen and Chad Waters for your thoughtful participation. We hope that you'll join us for our next webinar program, which we will announce shortly. Good day, everyone.